Welcome to Chilton Health's Community Medicine Project. Today we are going to explore health in the education setting, specifically focusing on the role of a school nurse, Miss Leonard, at Opie Elementary School in Galveston, Texas. The school nurse, also known as school health coordinator, receives medical training in health education and health needs of children. The school nurse is both a provider and a resource with responsibilities working to make health accessible and fair for all kids to have the same potential ability to learn. At Opie Elementary, Miss Leonard is responsible for caring for 670 students from kindergarten to fourth grade. Each day, she sees about 60 to 80 students, and she claims to have spoken to every single parent in the school at least once. She plays many roles, wears many hats, and is an incredible resource for the school for health education, prevention, and services. She stated, by taking care of our students' health needs and communicating with parents and teachers, I encourage students to spend maximum time in the classroom learning.
As former U.S. Surgeon General David Satcher has stated in Introduction to Community and Public Health, the school setting is a great equalizer, providing all students and families, regardless of ethnicity, socioeconomic status, or level of education, with the same access to good nutrition and physical activity. Children also teach their parents important lessons learned at school, which can help the entire family, thus improving the health of the entire community.
We believe that every child deserves to be healthy, safe, engaged, supported, and challenged. A student cannot learn if they are unhealthy. When the school nurse and faculty work together as a team, the school can be a side of health equity. Teamwork and health equity will be two repetitive themes as we explore and discuss the responsibilities of a school nurse.
Good morning, class. We have a very special visitor today. The school nurse is here to give us some important information, so let's give her our attention.
Hi guys, hi boys and girls. Well, today we're going to learn about something very, very important. We're going to learn how to wash our hands correctly. This is extremely important in limiting the amount of bacteria and germs that we spread, because no one likes being sick, right? No. Alright, so as you can see, we have these posters posted around the school. Miss Leonard teaches the students directly, she teaches teachers, and she also encourages the kids to teach their parents and families. It's a domino effect. So we're going to practice. We're going to turn the water on, get some soap, and do our ABCs twice. Now your teacher, I talked to her and she understands, so she's going to make sure y'all wash your hands every day. And I want to make sure that you go home and tell your parents the exact same thing, all right?
Okay.
And I'm going to give you a flyer, and you're going to take this home in your take-home folder and show your parents so that everyone can be healthy and hygienic, and you can work on it together as a family.
Mom, look what I got from the school nurse today. It's
What
your wash your hands and a cover your cough flyer.
Oh my goodness, this is great. Oh look, it's in Spanish and English. Muy bien. We'll have to work on this as a family together.
Yeah.
Yeah, I'm excited.
Engaging educational and integrative school programs also get students motivated and excited to learn about their health.
Mom, look what I got from school. These people came from something called Tooth and gave us a toothbrush and toothpaste and fluoride.
Oh wow, that's great.
Look, it's Four Eyes! What are you doing, Four Eyes?
Four eyes.
Go away.
Why do you have four eyes?
Go away.
Yeah, you're supposed to have two!
Sally, what's going on today? What brings you into the office?
I just don't feel really well.
That's odd. You're always up and active. Anything going on at home?
No, not really.
What about your friends? Who do you sit with at lunch?
They're kind of mean.
Your friends? Like, are they picking on you?
Yeah, kinda.
Uh-oh, what happened today?
Well, they told me Four Eyes because my glasses.
I'm afraid that's some bullying, and we have no tolerance for bullying at this school. You know what, let's find the root of this issue. I'm going to call your parents and talk to your teacher, and we're going to try to figure this out, because you need to be happy and healthy to do your best learning here at the school, okay? You have nothing to worry about.
Bullying is not tolerated. The nurse goes out of her way to pay attention to the manner, mood, and affect of each student. If bullying is occurring, it is the nurse's duty to intervene. As a team, the nurse, counselor, and teachers are able to work together to find a solution to the problem.
Hi, counselor. Thanks so much for meeting with us. This is Sally's teacher. Sally came in the other day and didn't look too good, and I asked her what's been going on, and it seems like some friends have been picking on her. I called her parents, and we all really need to get to the bottom of this.
No, I totally understand. And as we know, bullying is a zero tolerance policy, so we need to work together as a team to get to the bottom of this.
Definitely, and I've noticed some problems in the classroom too, so I think maybe it'd be a good idea if both Sally and then also the students involved could possibly come meet with you in your office.
Yes, definitely. Any student that needs to talk to me, I'm more than welcome. My door's always open.
Great. Well, thanks for being so flexible. Teamwork makes the dream work.
Yep, that's right.
Okay, Susie, so today we're going to be checking your eyes, okay? So can you take your right hand and cover your right eye for me? And then you're going to use your left eye and tell me what letters you see, okay?
As school nurse, Ms. Leonard conducts annual screenings for vision, hearing, height, weight, lice, and dental cavities on all kindergarten, first, and third grade students, in addition to any new incoming students.
B, C, F, D.
Okay, great. Okay, Samantha, I'm almost done, okay?
Okay.
Does your head ever itch or anything?
Nope, not really.
All right, well, things look good. You can go ahead and head back to class.
First and third grade students also receive screenings for acanthosis nigricans. If there are any positive findings, appropriate referrals are made.
Go ahead and move your hair. Is everything okay? You know what? I'm going to go ahead and have you go back to class and then send a pass to the teacher so that you can come to my office this afternoon, all right?
Okay.
Okay. Hi there, Jenny. Thank you for coming to see me.
Yeah, I got to miss math class.
Oh, so do you remember this morning when we were doing those lice checks?
Mhm.
So I did notice some little black lines on the back of your neck. Do you mind if I look one more time?
Yeah.
Can you move your hair for me? All right. So it's nothing to be too concerned about right now.
Okay.
But I did fill out this form that I want you to take home with you. I went ahead and called your mother and spoke with her so she knows that you're going to be bringing it home. So just make sure you put it in your backpack and give it to her tonight, all right?
Okay, I'll make sure to give it to Mom.
Hi there.
Hi.
Okay.
School nurse is responsible for providing care for medically fragile students and those with a variety of chronic conditions, everything from diabetes and coagulopathies to seizure disorders and cerebral palsy.
Okay, so it looks like your blood sugar is 135 right now. I'm gonna go ahead and record
Ms. Leonard
that
has a
in
huge
your
binder filled with
logbook.
detailed notes and care plans for the various medical conditions affecting OPI
All
students.
right, so you can go ahead and to lunch, and then once you have PE, make sure you come back so I can recheck your blood sugar, okay?
Okay, thank you.
All right, of course.
Ms. Leonard keeps her cabinet stocked with drinks and snacks, not only for diabetic students, but for those appearing underfed or with complaints of being hungry. And sticking with the constant theme of teamwork, the principal, counselor, and front office staff are all knowledgeable regarding the location of such snacks. So if Ms. Leonard is unavailable, they may offer the snacks to a child in need. It's also important to note that the school offers a free and nutritious breakfast to each and every student every single day.
Here's all the medications for Susie.
As school nurse, she's not permitted to give any medications, including NSAIDs, to any student unless the medication was approved and supplied by a parent.
Hi there, Miss Taylor.
Hi.
So as I understand it, you guys are going on a field trip to Schlitterbahn tomorrow, right?
Yes.
Okay, that's wonderful. So I already spoke with Miss Andrews back at the beginning of the year and educated her on how to give Susie her insulin for her diabetes and also give EpiPen in case Jimmy, who has a severe allergy, has an allergic reaction. But for the field trip, we need at least 2 teachers trained on how to handle the situation in case emergency.
Ms. Leonard also develops individual care plans for handling potential health emergencies on field trips. For example, she implements a plan for the management of a possible anaphylactic reaction in a patient with a severe allergy. She shares the care plan with a minimum of 2 teachers, ensuring they're educated on how to recognize and manage such a situation.
Thank you.
Hi, is this Susie's mom? Hi, this is Paige, the nurse at her school. I was just going through Susie's immunization chart and I noticed that she was missing her second MMR. Now, we do require it to
Tdap,
be
polio,
at the school,
varicella,
however-
MMR, and hepatitis A are some of the required vaccinations to start public school. An exemption can be made either by the child's physician stating that the vaccine is medically contraindicated or is at risk for the
And,
child's health.
Go ahead and make sure that you take a look at that for this new season.
Preventable diseases have become
Great.
rare,
Thank you, talk
but
to
can
you.
still
Bye.
happen. For instance, the United States experienced a record number of measles cases during 2014. 667 cases from 27 states reported to CDC's National Center for Immunization and Respiratory Diseases. This is the greatest number of cases since measles elimination was documented. The school nurse sends flyers home to the parents for any infectious diseases that have been contracted by the students. For example, she sends flyers home to parents regarding the flu and pertussis, as well as recommendations to the parents on when the students should return to school if contracting these illnesses. When the student tests positive for the flu, then the nurse reports the results to the Galveston County Health Department, and they can track which student and what classroom, as well as if another student tests positive for the flu. Overall, what we learn from Ms. Leonard is that she plays many roles, works together with her fellow colleagues as a team, and takes on many responsibilities. We grew to admire and respect her, as she is not afraid to stand up for what she believes in and is a wonderful nurse. She also gives a lot of credit to the students. She says that they are very smart and great observers. That is why she is so confident educating them on proper health techniques. According to a component of Community and Public Health, some of the benefits of having a full-time nurse include students are less likely to visit the emergency room, students are more likely to visit an appropriate healthcare provider if they have a medical referral from the nurse, students are less likely to miss school due to illness, and the achievement gap that students with chronic health conditions face can be reduced. Ms. Leonard is working hard to achieve all of these goals, and from what we saw, she is succeeding.
We hope you enjoyed learning about the roles and responsibilities of a school nurse. Thanks for joining.